One of the latest tools in the fight against COVID-19 is an antibody treatment called Regeneron. It has been in the news this week because some states like Florida and Texas are making that treatment available. And one viewer asked us to find out if the treatment's available in central Georgia.
Ramy Cohen talked with Dr. Jennifer Hoffman with Piedmont Medical about what it is and how it works.
For those already infected with COVID, a new treatment may be available to reduce its severity.
The Regeneron monoclonal antibody treatment can be helpful in terms of keeping people who would otherwise be high risk out of the hospital.
Dr. Jennifer Hoffman, an infectious disease specialist with Piedmont Medical, explains what the treatment is.
It's 2 monoclonal antibodies, so 2 kind of artificial antibodies to the COVID virus. And it's given via an IV infusion, a one-time treatment. You have to go to a special infusion center that's set up to do that. And then those antibodies will kind of bind to the virus in your body and hopefully help you fight it off.
Hoffman says it seems to reduce the risk of hospitalization or death by 70%.
It is recommended by the FDA that anyone with risk factors for severe disease go ahead and get the Regeneron antibody treatment.
Hoffman says it has to be done at the right time, within the first 7 days of symptoms.
The earlier the better. I mean, if you can get it on day 1, 2, 3, that's much better than getting it on day 6 or 7. So it has to be done in the outpatient setting before you get really sick. Once you get really sick, it's not going to help anymore.
In Macon, Ramy Cohen, 13 WMAZ News.
We reached out to Michael Hawkinson about the availability of Regeneron treatment in central Georgia. Hawkinson says the North Central Health District isn't involved and referred questions to area hospitals.
As coronavirus cases climb across the country in what health leaders call a fourth wave, the CDC says you will soon have to get a booster shot. The Biden administration formally announced plans to distribute COVID-19 booster shots for adults 8 months after they received their second dose of the Pfizer or Moderna vaccine. Newly released studies show the effectiveness of the 2 mRNA vaccines against infection drops over time due to the rapidly spreading Delta variant. Federal officials say they are awaiting more data before giving booster shot recommendations for minors and those who have received the 1-dose Johnson & Johnson vaccine.